President Trump this morning tweeted, "Flu season is coming up. Many people every year, sometimes over 100,000, and despite the vaccine, die from the flu. Are we going to close down our country? No. We have learned to live with it, just like we are learning to live with COVID. In most populations, far less lethal."
The tweets reiterated a common refrain about the coronavirus that some feel it's no worse than the flu.
NewsNation's Nicole Burley dove into the facts about the flu, showing how the infection and death rates differ from COVID-19. Nicole?
Well, Joe and Marnie, there are a lot of facts and figures associated with reported cases of the flu and COVID-19. So we at NewsNation wanted to take a closer look at the actual data from both the CDC and Johns Hopkins University. Both COVID-19 and the flu can be deadly. As of today, more than 210,600 people have died from COVID-19 in the United States. That's according to the latest data from Johns Hopkins University. According to the Centers for Disease Control, an estimated 22,000 people died during the 2019-2020 flu season. That means influenza deaths are at just over 10% of total coronavirus deaths, and the U.S. COVID-19 deaths only started being reported in March of this year. By comparison, total reported U.S. COVID-19 cases are at just under 7.5 million, according to Johns Hopkins, while the CDC reports an estimated 38 million cases of flu in the 2019-2020 season. There are more than 5 times the number of influenza cases versus COVID cases, but the death rate for COVID-19 is just under 3%, compared to a death rate from influenza of a fraction of 0.5% for the 2019-2020 season. And of course, we just want to give you the facts here. The numbers from Johns Hopkins are constantly being updated as new information is reported. Our numbers are from late this afternoon. As for the CDC's numbers, the agency's website notes that the 2019 through 2020 season estimates are preliminary, and they may change as data are finalized.
Well, we've spent a lot of time lately talking about COVID-19, but we're also heading into flu season. So we know you all have a lot of questions about both. And let's start there. We wanted to know what questions you do have about the flu versus coronavirus as we head into flu season. And we're asking a medical expert tonight. So joining us to answer your questions and a few of mine, Dr. Dean Winslow. He's a professor of medicine at Stanford University Medical Center with more than 40 years of experience. Dr. Winslow, welcome to NewsNation. Thank you for joining us on this important topic.
Well, thank you for having me on WGN. Really appreciate the good work that you're doing to inform the public.
Well, thank you very much. Let's start with some numbers, if you will. American Medical Association, along with the CDC, says 45 million Americans get the flu approximately each season. 810,000 Americans are hospitalized, and between 12 and 16,000 people die from the flu each season. So with that said, what is your message for people tonight as we head into flu season in the middle of a pandemic?
I think there are several really important messages, I think, for people to keep in mind. Number one is both SARS-CoV-2, COVID-19, and influenza are potentially lethal diseases. One of the things, though, I'd like to really remind people of, though, is the fact that we do have the influenza vaccine, which is proven safe and effective. So I certainly encourage, all Americans, unless it's strictly contraindicated, to get their flu shot. In fact, I had my double dose flu shot today, since I'm over age 65. One of the things that I think may be a small bit of a silver lining from this year's terrible COVID-19 pandemic is the fact that maybe many of the mitigating factors that have been put into place to reduce the transmission of COVID-19 may also result in a fairly mild flu season.
How soon should people get the flu shot for efficacy? I've heard mixed reports on this.
Yeah. So again, I got mine today. Usually flu starts, as early as mid to late October. It takes, remember, a couple of weeks before you develop an antibody response to really any type of vaccine. So I really encourage people to get it certainly this month, if at all possible. There's a little bit of I would call it anecdotal data to suggest that if you had particularly a very late peak of flu, like in late March or early April, which is very unusual, that if you got your vaccine early in the season, that potentially the vaccine efficacy would wane somewhat. But again, this is very controversial, and I think overall, the benefits of getting your vaccine early outweigh the potential downside of perhaps having the protection wane a little bit by late March or April.
All right, Dr. Winslow, I have a question now from J.A. He posted this on our NewsNation social media accounts tonight. He wants to know, how accurate are the PCR tests? And I should note, there are two types of tests. There's a diagnostic test, and there's also an antibody test. So walk us through the different tests and the accuracy for COVID-19.
Yeah, absolutely. And of course, the tests do vary a little bit by both what we call sensitivity, that is the number of basically true positive people that you accurately diagnose, and then the specificity, which means that you're not calling people infected that actually don't have infection with the virus. So PCR test, it stands for polymerase chain reaction, and these are very sensitive molecular tests. So assuming the swab is collected properly, rather, that the sensitivities are probably in excess of 95%, at least if you're in the window of when you're likely to have a positive test. We also have some what are called rapid antigen tests that are very quick, almost like point of care sort of tests, and their sensitivity is somewhat less than the PCR or molecular tests. So those are the two tests that are available, and obviously that there's advantages and disadvantages to both. Often, again, the turnaround time may be a day or even a little longer for the PCR test, which is the more sensitive one.
All right, Dr. Winslow, I now have a question from Tracy Ann. She says, what is the most common symptom, again, of COVID-19? She says, I was exposed Friday. I have no symptoms so far. I am obese, 61, and probably have heart issues. I am terrified. And I just want to piggyback on Tracy Ann's question. Are there symptoms of COVID-19 that distinguish it from the flu? A few I have heard, smell is one, and also itching or sores on the fingers and toes. Can you walk us through the symptoms and the ones to recognize?
Yeah. So again, both influenza and COVID-19 both present often with fever, although as many as 40% of people with COVID-19 at least don't initially have fever. Cough is common in both, shortness of breath. So there is significant overlap. You did mention this, what we call anosmia or ageusia, which is difficulty tasting and smelling. And that actually is very specific, for COVID-19, although it's not all that common. In other words, not every patient has that. My own mother, age 91, actually that was one of the ways that she presented back in March with COVID-19. She lives in Delaware.
Wow. Well, thank you for sharing that. How is your mom now?
She's doing great. Yeah, she's back to normal. A former school teacher. She's a tough lady.
Oh, well, we're glad to hear that, Dr. Winslow. Thank you for answering my questions and our viewers tonight. And I want to thank J.A. and Tracy Ann for sending those questions in. My best to you and our best to your mom as well.
Great. Okay, thank you very much.
Thank you.
And have a good day. Bye-bye.